So we'll look at the thorax. You can see the rib cage. Okay. This is the sternum, manubrium, body, and the xiphoid process. This is the superior thoracic inlet here, and this is the inferior thoracic inlet. Now we'll look at the model of the. We'll see. This is the pectoralis major, and here you can see the breast tissue. This is the nipple, and if you remove this, here you can see the lungs and heart. And to be precise, this is the left lung. Left lung has two lobes, and it is separated by the oblique fissure. And this is the right lung. You can see it has three lobes. So 1, 2, 3. This fissure and this fissure, horizontal and oblique fissure. And lungs are present like this. So if we, this is the heart. It is present in the mediastinum. There is a common saying that heart is present in the left side. So see, this is tilted. It is actually in the middle, but it is slightly projected towards the left side. That's why we say heart is in the left side. So if you remove, I can show you the heart model. This from inside. Here you can see the trachea, and trachea dividing into the bronchus, and this enters into the lungs. This structure here, this is the esophagus, and this goes into the stomach. This is the ascending aorta, and this is the superior vena cava. Superior vena cava gets blood from the brachiocephalic vein, and this becomes the arch of aorta. So now we'll look at the model of the heart. So this you can see the arch of aorta, the ascending aorta, arch of aorta, then the descending aorta which goes into the abdomen. This is the descending aorta. So arch of aorta has three parts: the brachiocephalic trunk, then the right common carotid, and then the left common carotid, and then the left subclavian. Brachiocephalic trunk, left common carotid, and the left subclavian. And if you remove this, so this is the right atrium, and this is the left atrium. And if you remove this, this is the right ventricle and left ventricle. And the action potential in the heart originates from the SA node, which is present in the right atrium, the upper part of right atrium here somewhere. And it goes to the AV node, which is present somewhere here, and then it passes through the bundle of His and then the Purkinje fibers, and it goes to all the tissues of the heart. Now the valves. This is the AV valve, atrioventricular valve. Here we can see. In the right side, it is a tricuspid valve, and it is in the left side, it is bicuspid valve. And this is the aortic semilunar valve, and this is the pulmonary semilunar valve. Here, these are the coronary arteries, coronary arteries and the veins. And here you can clearly see the coronary sinus, the big part. Inside the right atrium, there is fossa ovalis. It is a depression. In the fetal life, this is a foramen ovale, where the right atrium and left atrium blood mixes in the fetus. But in the adult, this closes, and it is called fossa ovalis. And there is a common saying like hole in the heart. If this doesn't closes in adult life or child life, then it is called the hole in the heart. So we looked at the heart model, and now the thorax, little bit, just the basics left. This is the diaphragm, you can see here clearly, which separates the thoracic cavity from the abdominal cavity. Now this is the thyroid gland, and this is the larynx. The trachea continues here from here, and it divides into right and left primary bronchus. This is the sternocleidomastoid muscle. This is the hyoid bone. This is the deltoid muscle, and here you can see the ribs. So how the lungs are placed and heart is placed, now I think you have got a clear understanding how it is present.